point is I want to tell you about few of the apparatus which is positive airway pressure. Okay, positive airway pressure, it is a mechanism, but this mechanism is applied in an apparatus, and that apparatus is used in few of the conditions. I hope some of you remember, in our college already we got an apparatus that is BiPAP. Okay, I have the people were coming and showing the demo, and I was keeping you along with me and showing the apparatus, right? So that is a class I'm taking now. So this positive airway pressure, it is a mechanism, or it is a principle, and it is given along with the apparatus. That apparatus wise we have three types. One is CPAP, APAP, and BiPAP or BiPAP. Okay, CPAP is nothing, it is continuous positive airway pressure. Continuous, yeah, so the term itself describes there is a continuous way of pressure is going to come. So this is commonly when we can prescribe this kind of pressure and apparatus, it is mainly used to treat sleep apnea. Okay, sleep apnea, we can call it as orthopnea also, and also it is called as OSA. OSA means obstructive sleep apnea. So obstructive sleep apnea, in the sense the person will be having breathlessness when they are awake, but it will be more when they are sleeping, especially when they are sleeping in the supine position. There is a more chances of getting obstruction. So these kind of obstructions, and it is leading to apnea. So it is described as obstructive sleeping apnea. I mean OSA, which is obstructive sleep apnea. So this obstructive sleep apnea is can be treated with apparatus that is CPAP. Okay, so what it is doing is it causes collapse. If the apnea is persisting, it causes collapse of the lungs. So we have to avoid this. So the CPAP machine sends a steady flow of pressurized air into your nose and mouth during the sleep, so that it keeps the airways open and helps you breathe normally. I mean, helps the people who's having that, and they can breathe normally. So as we seen already, so nothing. For example, the person is getting an obstruction here. Why the obstruction is happening? Because of the secretions, and obstruction is happening, and there is no airflow is happening. Instead that we ourselves from outside, if we send the airflow and keeping the pipe or the tube to be intact without collapse or without obstruction, there will be the steady flow of breathing. That is what the CPAP is doing. I hope so it is clear now. So every apparatus has a mechanism or a principle. So this apparatus, as we already seen, it has a mechanism of positive airway pressure. So from outside we are creating a positive airway pressure. So as we know already, when the pressure is getting higher, it always go to the lower pressure. So we are giving a positive pressure inside, obviously the obstruction is getting relieved. That is why we are giving a positive pressure. Okay, so what is the mechanism is, along with the positive airway pressure, the CPAP has a compressor. It is one of the part of the apparatus. The CPAP has a compressor, generates a continuous stream of pressurized air which travels through a filter into the tube. So this I have shown you in the college, like how is this apparatus. It will be like a box. That box, it has a compressor. It is only going to create a pressure, and that stream of pressurized air is going to travel through the filter into the tube, because the pressurized air should not have any kind of other debris or dust, so that it is going to get into the filter into the tube, which is also one of the part of the apparatus. Then the tube delivers a filtered or purified air into the mask to the nostrils of the patient. So they will be I'll tell the parts of the apparatus. Before that, I'll tell how it is. So the compressor is producing the pressurized air. The pressurized air is traveling through the filter, and the filtered air is coming through the tube to the mask and to the nostrils. Okay, so this is what happening. So this can create always the airways to push against the blockages and increases a higher volume of air exchange. Okay, so this is what the mechanism is. Now coming to the parts of the apparatus. So what and all we have seen that day, we have seen like a box, and we had the tubes along with the filter, then the mask. So all those things are the parts of the apparatus. So to be little more detailed, it has a motor house base unit and cushioned mask, tube that connects motor to the mask, and head gear frame, elbow pieces. It's like a joints. Elbow pieces, don't think this elbow like a bent way of pieces. That elbow pieces is like a joint where we can connect the direction of the tubes can be changed. There we use an elbow joint and elbow pieces, and then adjustable straps. So these are the parts. And mask wise, we have two masks. One is nasal pillow mask, which is only used during the sleep, and another one is full mask, which is used often. So mostly even at the apparatus what we have at college, there we have the full mask only. Okay, so this is the CPAP, and CPAP is a steadier one and mostly used. Next one is APAP. APAP is a automatically adjustable pressure, positive airway pressure. And next is BiPAP. BiPAP is bi means bi-level. Okay, so automatic APAP and CPAP, it is going to be the similar one, but here this continuous pressure and positive airway pressure, it comes continuous. Here automatic, it is according to the lung functions, it is going to change its variations in pressure. That is automatic positive airway pressure, that is APAP. Next is bi-level. So in bi-level also they have two pressure settings. It has two jobs. Like CPAP has just a one job to make the stop the obstructions and stop from the collapse, but here it has a two job. So what is a two job is, it's depending on the settings. Like that we can manually change the setting, and it can improve the level of oxygen to be improved. That way we can work, or we can work in decreasing the CO2. Like sometimes we see like oxygen level is fine, but the patient is hypercarbic. So what we can do, so we have to reduce the CO2 level. So that way also we can set the BiPAP. Okay, so mechanism same like CPAP, I mean the positive airway pressure, but here it is based on inhalation and exhalation. Like how is the inhalation is reduced, so that we have to improve the inhalation. Then the mechanism is IPAP, inhalation positive airway pressure. If the exhalation is not so fine, then we have to work with the exhalation. Then it is exhalation, expiration or exhalation positive airway pressure. Okay, so this is the CPAP, BiPAP and APAP. So where and all we can use is mainly in the sleep apnea cases, apart from that conditions like obstructive lung diseases, COPD, and especially with the obese people, obesity, hypoventilation syndrome, and then as we've seen already, OSA, obstructive sleep apnea. Hope you understand this. Please refer your textbook, and you can Google about how is the apparatus is. Even our college has apparatus. If you get time, you can go and see that. Thank you.